Well, first off, the fact that family members are concerned about their loved ones who are incarcerated, we understand that, and that's why we're taking many steps, not just an early release of some of these nonviolent offenders. I'll just go through some of the list of the things that are being done. I issued an emergency proclamation which waived certain requirements to be incarcerated who'd violated terms of their parole so we could keep the numbers down in our facilities. We have increased screening, testing, and disease control guidelines that are consistent with the CDC requirements. We early eliminated visitation at the Department of Corrections in order to prevent the infections going into the facilities. Now, this is anxiety producing for the families. I can understand that because they can't see physically their family members, but it is a necessary step to reduce the rates of infection. We have begun screening of all new inmates using screening questions and temperature checks. The DOC has reduced the intra-system transfer from facility to facility and reduced it fairly significantly. They've implemented guidelines for personal protection equipment for staff, and they have bolstered cleaning for the DOC facilities. They've issued new hygiene supplies to the incarcerated individuals and teaching them the social distancing technique that, frankly, all of us need to be involved in. And they are also isolating, both with singular isolation of people who have tested positive, but also embraced what's called cohort isolation of people in the pod that has been affected, so that only about 3 people might be in a unit, so they're not exposed to hundreds of people in the dormitory-like setting. The point I just referenced these is that there's a lot of work going on besides the early release protocols, and that's the right thing to do, and we're doing it. The court, besides the court ordering this to be done, it's something we've been working on now for weeks and months to try to reduce the risk to people in these prisons. We do have to recognize this, though. Everyone in the state of Washington is at some risk for this today. And no one is going to have it totally eliminated. And all of us should pitch in to try to reduce it. That's what we're doing for our incarcerated individuals.